Joining us now, North Carolina Congressman. He is Dr. Greg Murphy. Doctor, it's great to see you. You know, Doctor, we've seen so many confusing statements coming out of the White House and the administration on the pandemic. We know what we've seen from Dr. Fauci, right? We understand that the science evolves, but the messaging has been confusing. Now we first see the White House saying we will give the states antibody monoclonal treatments as needed, where they're needed. Now they're rationing them. And we've got Florida Senator Rubio warning, saying we're going to have a COVID surge in these states as we head into the winter. Shouldn't they? And also Florida Governor DeSantis recently said we're seeing half our supply getting cut. Now the White House is saying we're doing an equitable distribution between the states. But why the switch up? Why the change?
Yeah, it's sad, Liz, because just think about it strategically. If you're in a battle somewhere and you have a long front and all of a sudden the enemy is more lopsided on one side of the battle, well, if you want to be equitable about things, you put the same number of troops along the whole battle, and then you lose the war because they came in on one side. So equity here, which is the mantra of the Biden administration, really costs people's lives. What is required is reallocation of supplies where the most need is evident. And for the Biden administration to not do that is just showing again and again and again how political this administration is, and they're truly not caring about lives. And I do believe it disproportionately, as Roger said, are affecting red states. So you know what? If you really do care about the American people, reallocate the supplies to save lives.
You know, Doctor, there's also this, Congressman, COVID confusion. OSHA has yet to release the draft of its rules to force private businesses to mandate vaccines. This is nearly 2 weeks after President Biden demanded this, and we have state health officials really confused. They don't know what to tell people about boosters. Confusing messaging here. Dr. Fauci said, wait for the data. We got to wait for the data. Now he says the president was not premature in wanting boosters right now after the FDA panel said no, not enough data. So, you know, it's round and around and around we go.
It is. And Liz, look at why it was done. The science was not there. The next day after Biden made that declaration, the FDA and a bunch of other scientific organizations said, wait a minute, the science is not there. The Biden administration did this, and let's just be very plain and clear, to try to divert attention, throw a shiny nickel down the road to get the media off of Afghanistan. It was timely, and then all of a sudden he makes this massive declaration and there's nothing to back it up. What's it done? It, of course, got mainstream media to pull off of the debacle of Afghanistan, which is still going on, by the way, and to chase something with no substance to it. So it's making businesses extremely worried about what their future holds because there has been no policy, there's been no declaration. Different states are going to have different ways to implement this. So again, you go back to what I just said 2 minutes ago. The Biden administration has shown to be the most divisive and partisan administration, in my opinion, this nation has ever seen, based wholly upon politics.
Yeah, you don't want to politicize a pandemic, right? So we get it that the science evolves, right? But, you know, Dr. Fauci has been all around the bend about masks. He called masks, quote, paranoid 2 years ago when he was asked, should you use masks with airborne illnesses? Watch this.
And the best way for me to prevent getting an infectious disease and having to have you as my doctor is what? Wearing a mask?
No.
Don't need to do that. If somebody's, I can see they're ready to sneeze or cough, walk away.
You avoid all the paranoid aspects and do something positive.
Your reaction?
Yeah, avoid all the paranoid aspects of Dr. Fauci. You know, again, the science does evolve. I've said a million times that we've been building a plane while flying it. But the problem with Dr. Fauci is that he's taken off his medical hat. Instead of medical science, it's become political science. And let's have a continued message that is aside from politics, it's aside from the cult of personality, and give the American people straightforward and honest, objective advice. If you don't know something, say it. But don't tailor things according to what the Biden administration would want you to say or what looks best for you in the future. You know, a lot of things a mask we don't know about. We don't know about it. If masks were such a panacea, then we would never have seen the third surge. What we need to do now is get people vaccinated. I've said that since day one. We need to reallocate our supplies for Regeneron, and we actually need to work sufficiently and ardently now on getting therapeutics to the American people.
Congressman Dr. Greg Murphy, it's good to see you. Come back soon.